Welcome back to channel. Welcome to today's video. Today I am at the Bharati Vidyapit. You can see up over here it's actually School of Audiology and Speech Language Pathology. This is where I started my speech and hearing journey as a student. Okay, we are not going to college today. We have a very interesting 3 days of workshop arranged by Bharati Vidyapit. We are going towards the workshop venue. There are multiple reasons to come because it is in Pune. There is CRE points. And there are friends coming. And I can meet my teachers. So because of the multiple reasons, I decided to attend this workshop. I'm sure this is going to be a lot of fun and learning. In the final discussion by Dr. C.S. Vanaja, Dr. Namita Doshi, Dr. Piyush Sone and Ms. Dinaz Badia, they discussed about the auditory processing's blind spot. Are SLPs and audiologists missing a critical skill set in language and literacy intervention? So they have spoken that awareness in teacher is very important. Mostly teachers are more concerned about the academic success. With respect to the research, Vanaja ma'am has mentioned that there are enough tests which are available, but the link between the auditory processing and the phonological processing is what is required the most. And Dr. Namita has mentioned that music can be used as a part of a holistic treatment approach. Dr. Sharda Sarada and Dr. Pallavi Kelkar spoke about the tests and the tools for assessment of auditory processing, language and literacy developed at Bharati Vidyapit School of Audiology and Speech Language Pathology. These tests analyzes different aspects of hearing: auditory closure, auditory integration, auditory memory and sequencing. These are interlinked but represents different parts and functionings of the auditory pathway. Sharda ma'am mentioned that one of the most important tests for auditory closure is spin test, along with time compressed test and low pass filter test. If one wants to test binaural integration, then there is dichotic test, which includes two different stimuli in the form of digits, words or sentences. We can ask the child to give the answer in directed attention format. For example, repeating the word heard in a specific year. We also need to consider that the children between 4 to 5 years of age may not give very appropriate responses, and there is always a maturational effect or a cognitive effect. Hence, there are different normatives for different age groups. If the scores are below normatives, then child can have an auditory closure issue. Binaural integration tests specifically suggest the maturation of a corpus callosum. Memory and sequencing tests can be done by presenting 3 words and asking child to repeat. You can slowly increase the difficulty by increasing the number of stimulus. There are already normatives developed from 5 years to adults, which is available in Marathi language. She also mentioned the need to do more research in other local languages. Pallavi ma'am mentioned the tests and the tools developed at Bharati Vidyapit Pune. It was so nice to see so much of research has already been done by Bharati Vidyapit in this area. So these tests are either developed in Marathi or adapted from the other tests. If you want to get the access of these tests, simply write to the mail mentioned on the screen. Vanaja ma'am opened by explaining the foundational concept of auditory processing and auditory processing disorders. She defined auditory processing disorder as the efficiency and effectiveness with which central nervous system utilizes auditory information. She briefly discussed the core auditory processes involved, emphasizing both sequential and parallel processing mechanisms. She also distinguished between intrinsic redundancy, the redundancy built into the auditory neural pathway, and the extrinsic redundancy, which relates to the clarity and richness of the acoustic signal itself. When a question of prevalence was raised, my initial estimate was 1 to 2 per 1000, but the actual prevalence was nearly 10 times higher. She explained that central auditory processing disorder significantly affects speech understanding, reading, and comprehension and makes listening highly effortful. She described a practical method of differentiating CAPD from auditory neuropathy spectrum disorder (ANSD), that is by examining speech scores. Individuals with ANSD generally demonstrates poorer speech scores in quiet compared to that of a CAPD. She also highlighted that CAPD frequently co-occurs with conditions such as learning disability, a history of otitis media, specific language impairment, stuttering, ADHD, and cleft lip and palate. She then addressed the central question: should CAPD be identified at all? Considering that clinicians cannot directly treat the disorder itself, she noted that Jurger argued that CAPD should not be identified as a separate entity, while Moore proposed that CAPD does not exist independently and it is merely an aspect of other developmental disorders. However, she presented a contrasting viewpoint. A study conducted on students suspected of having APD provided the clear evidence that CAPD does exist as a direct, distinct clinical condition. She concluded by outlining a recommendation for screening, diagnostic, and intervention. Screening should be performed by all professionals involved in child assessment. Diagnostic testing must be conducted by audiologists, and intervention can be managed by special educators and speech language pathologists. So today I am with the friends, my college mates, Sunil, very successful practitioner, Ketan Patil and Sarang Mistry. They are both from Nashik, and all these four guys who are with the first batch of Bharati Dapit and our classmates. Now we are again together. Nice to see you all.
Yes, it is such an honor, Dr. Anand, to have been associated with us for a long time.
Dr. Deepa Balame clarified the critical points about CAPD assessment that clinicians often misunderstand. She explained CAPD evaluations include both behavioral and physiological tests, but the emphasis should always remain on behavioral measures because they reflect real listening skills. A common myth is that APD testing must be conducted only inside a sound-treated room. That is incorrect. Research by Yatiraj clearly showed that APD assessment can be carried out in adequately quiet environment without compromising diagnostic validity. It is also essential to understand the neuromaturation influences performance on different auditory processes. For example, temporal processing continues to develop until 8 to 10 years, while dichotic listening matures around 12 to 13 years. Age-specific norms, typically starting from 5 years, must be used to interpret results accurately. Regarding test battery approaches, two major models guides CAPD evaluation. The Ferre model recommends a purely behavioral approach and excludes electrophysiological tests. In contrast, CATS advocates for including physiological measures alongside behavioral tests for a more comprehensive evaluation. Rucha Vivek from Audiology and Speech Language Pathology, Bharati Vidyapeeth, focused on the most crucial aspect of CAPD intervention. She emphasized that effective management must follow three non-negotiable principles. It must be early, individualized, and evidence-based. She described three parallel components of management: direct remediation, compensatory strategies, and environmental modifications. These cannot be applied in isolation. They must work together to create meaningful functional change. Direct remediation is grounded in neural plasticity. It uses bottom-up approach that targets specific auditory processing deficit. Along with this, intervention must strengthen metalinguistic and metacognitive abilities such as language skills, attention, and self-regulation, so that the child learns to be an active listener who consciously monitors and adjusts listening strategies. Compensatory strategies overlap with those used for hearing loss. They include anticipatory strategies, repair strategy, and any other technique that help individual manage challenging listening environmental more effectively. Environmental modification involves reducing noise, minimalizing reverberations, optimizing classroom acoustics, and incorporating assistive listening devices whenever needed. For home-based and clinic-based auditory learning, she recommended tools such as Angel Sound app and Listen and Learn program for CAPD management. Towards the end of the first day, we visited a separate test booths where master students demonstrated how various CAPD tests are actually performed. Using a laptop and a headphone, they walked us through the tests like trichotic digit test, auditory memory test, and auditory sequencing tests. This hands-on experience allowed us to experience the procedures from the listener's perspective and understand how each test evaluates a specific auditory processing skills. On the second day of the CRE program, the focus shifted from CAPD to the broader domain of language, and the entire day explored different facets of language related challenges in children. The first session was led by Ms. Kuhu Kulkarni, who spoke in depth about the assessment. She used a very powerful analogy. Assessment is like drawing a map. The more landmarks we identify, the easier it becomes to choose the correct direction. And when the map is incomplete, we are left uncertain. This set of foundation for understanding why structured and comprehensive assessment is essential in language intervention. She then revisited the fundamentals, including the reception and expressive language, the purpose of assessment, and the core goals of conducting assessments. However, one of the most interesting points was the introduction of a screening tool developed by Bharti David, the screening test of early language development. This tool is specifically designed for children between 6 months to 18 months of age and serves as an early indicator of developmental concerns. Ms. Kulkarni also explained that a comprehensive language assessment should never rely on a single method. Instead, it should include a combination of approaches such as naturalistic observation, developmental assessment, play-based assessment, and discourse assessment. The concept of discourse assessment was particularly notable because it examined connected language beyond the sentence level, looking at linguistic structure, pragmatic use, and cognitive organization. Another concept introduced was narrative analysis, which is closely linked to academic success and has high ecological validity. These approaches provide a more complete and realistic understanding of a child's communication abilities. She also presented a wide range of language assessment tools developed within the Indian context. These include the linguistic profile test, the assessment of language developmental manuals, the receptive expressive emergent language scale, and several tools specifically developed by Bharti David. Among them is the development of language test in Marathi for children between 7 to 12 years, as well as checklist for assessing pragmatic skills in preschools. One important issue she emphasized is that although India is a multilingual nation, there is still a shortage of standardized language assessment tools across Indian languages. As a result, code switching and code mixing, both natural features of multilingual speakers, may often be misunderstood as errors rather than reflections of child's developing linguistic competence. She also highlighted current recommendations related to children's screen time. According to WHO guidelines, screen exposure is not recommended at all for children between 0 to 18 months. For children between 3 to 4 years, screen time should be not exceed 1 hour per day. Overall, the session offered a detailed and structured view of language assessment, reinforcing the importance of a systematic evolution and culturally relevant tools to ensure accurate understanding and appropriate intervention for every child. The next session was conducted by Ms. Dinas Wadia, Director of Disha Mumbai, and her topic was focused on the foundation of language intervention from birth to 6 months of age. Her session offered powerful and experience-driven insights that reshaped the way early intervention should be approached. One of her strongest messages was the intervention does not begin only after assessment. Instead, intervention starts the moment a child enters clinical setting. Every minute of the initial encounter holds value, and therapy should make full use of the precious time. She emphasized that the first priority in therapy is always the child, followed by the parent, and only then the information collected from the parent. This shift in priority ensures that the child's engagement, comfort, and the natural response remain central to the therapy process. Ms. Wadia highlighted that child seen on day 1 is often very different from the same child on day 3 or day 4. For this reason, assessment and therapy must be dynamic and progressive. If a child wants to stand, for example, we should not force them to sit simply to follow a planned activity. Therapy should follow with the child's natural state and not against it. It should be a space where therapy strength supports the child rather than a rigid teaching environment that restricts them. She also emphasized the importance of environmental factors. Elements such as background sound, lighting, and overall sensory condition in therapy room can greatly influence a child's participation and comfort. Additionally, she encouraged clinicians to help parents understand how to carry therapeutic experiences into the child's natural environment, making learning more meaningful and continuous. Communication styles matters as well. Our tone, body language, rate of speech, and the way we introduce activities all impact how effectively the child engages. Providing a brief heads up before starting an activity can help the child prepare and feel supported. Above all, she emphasized accepting the child as they are and ensuring they feel emotionally safe throughout the process. Monitoring child's progress is very essential to ensure therapy is moving in the right direction. Ma'am shared a range of practical strategies to enhance different components of auditory skills, including perception, memory, figure ground abilities, and auditory closure. Through multiple real life clips, she demonstrated how these approaches look in natural clinical practice, giving participants valuable real life takeaways. Towards the end of her session, she also discussed the value of a group therapy and highlighted an important developmental flow. Progression should move from listening to language and from language to literacy. Supporting auditory processing and language skills early on lays the strongest foundation for later literacy development. The next session was delivered by my teacher, Dr. Namita Joshi, who owns three clinics in Pune. Her presentation offered a practical and modern perspective on language therapy, emphasizing the need to adapt our approaches to the communication style of today's children. Therapy, she noted, should begin with observing the child's and identify what interests them. Engagement improves when activity aligns with the child's natural preferences. Dr. Joshi has also developed a comprehensive set of age-based therapy goals, which she plans to convert into an app, a tool that will greatly benefit therapists across India. She highlighted the strong value of group therapy, especially for children aged 6 to 16. At this age, group-based activity fosters enjoyment, friendly competition, and natural interaction. She also encouraged involving parents directly, promoting a parent-child participation model in which parent acts as an active partner in the group therapy session. Dr. Joshi emphasized that cognitive abilities such as working memory, attention, problem solving, and metacognitive skills must not be overlooked. Even if a child produces complex sentences, weak cognitive foundation may lead to academic difficulties. She also pointed out that today's children use new slang terms like Gucci, lead, lol, and goat, which understanding such vocabulary helps therapists connect with them and break the ice more effectively. She encouraged collaboration with schools to develop individualized education plans and recommendations using technology, including audiobooks for children and parents. She also shared useful online resources such as preschool.in, storypeople.com, and kfilearning.com. A notable method she discussed was video modeling. When children see themselves on video, their excitement often increases, leading to a noticeable improvement in language output. She also recommended set speech by Tasneem for teaching idioms and sarcasm, and advocated the use of VR and AI based games to improve social skills, noting that many children perform better in virtual environments than in real life situations. Overall, her session presented a forward thinking approach to integrate technology, update communication trends, and cognitive development into language therapy. Post lunch, Dr. Piyush Soni presented a powerful session on building literacy by connecting auditory processing, language, and developmental challenges. He explained that auditory processing is a complex mechanism, and even today, there is no single agreed cause or standard test battery to diagnose central auditory processing disorders. Spoken language processing is not one skill but a combination of abilities like auditory memory, sequencing, attention, and temporal processing, each assessed through specific evaluation tool. Dr. Soni also shared insights from his research and spoken language processing. While some questions remain, such as whether auditory processing directly affects literacy, current research strongly suggests that auditory processing influences literacy development through phonological awareness. He reminded us that literacy is not just reading and writing, it is the ability to use language effectively, and the ability depends on strong auditory, phonological, and language foundations. With more children facing challenges in these areas. Both speech language pathologists and audiologists must work together to support them. The final session of the day was conducted by Dr. Jyoti Mohte from Nair Hospital, who spoke on evaluating literacy in Indian children. Her presentation focused on the unique challenge of assessing literacy in linguistically diverse country like India, where we have 22 major languages and multiple scripts. This diversity makes literacy evaluation far more complex than in monolingual contexts. She emphasized the crucial role of speech language pathologists in literacy assessment. SLPs are acquired not only to evaluate language components that influence reading and writing, but also to identify early risk factors for learning difficulties such as dyslexia and specific language impairment. Based on these insights, SLPs can design interventions targeting phonological, morphological, and semantic skills to strengthen literacy development. Dr. Mohit explained the stages of early language development that supports literacy, starting from emergent literacy, moving to alphabetic awareness, word and pattern recognition, and finally progressing to more advanced levels. She noted that SLPs bring a unique blend of skills to literacy instructions due to the deep understanding of language development, diagnostic expertise, and the training in the International Phonetic Alphabet, which enables precise transcription and sound analysis. She highlighted that literacy assessment must cover skills like phonics, word recognition, reading fluency, comprehension, spelling, and written expression. However, due to the linguistic diversity of India, standardized literacy tools across Indian languages are still limited. She recommended the development of such tools along with specialized training for SLPs in multilingual literacy assessment. Additionally, she encouraged early identification of literacy challenges and stronger collaboration between speech language pathologists, educators, and psychologists. Dr. Mohite concluded by emphasizing that India requires a context sensitive and culturally relevant approach to literacy assessment, especially in multilingual population. Her session highlighted the importance of empowering SLPs to contribute more meaningfully to literacy outcomes in India. Third day began with the panel discussion that brought together school principals, teachers, psychologists, and faculty from School of Audiology. The focus was school accommodations for children with auditory processing and literacy disorders. The discussion opened with the hard truth. India has the world's largest child population, which naturally means we also carry one of the highest burdens of developmental disorder. Schools must also acknowledge this reality and adapt their systems accordingly. Lesson plan need to cater the weakest of the child. Speech language pathology must provide direct remediation, track progress consistently, and set up goals that begin easy and build gradually. Every session should end with the child experiencing success and not the frustration. Teachers must pay attention to signal to noise ratio in the classroom and ensure that loud external sounds are controlled. An interesting strategy shared by the school was the use of noisometer. When a student speaks too loudly, the classmates point to the noisometer, making everyone more aware of their speaking volume. Beyond academics, teachers must also address the emotional needs of the child and actively identify their strengths. One creative approach was the I Can Wall, where children can write down their accomplishments during the week and also what they have done things differently. They promote self-confidence and reinforces positive behaviors. Intervention should also be holistic, considering the child's family environment, health, emotions, and learning needs, and not just the disorder itself. As ASLPs, we must collaborate with other team members rather than working in isolation. Inputs from teachers, psychologists, and parents are essential for meaningful progress. Finally, ASLPs should proactively engage with schools by conducting awareness workshops for teachers. This ensures that classroom practices evolve to support children with auditory processing and literacy challenges more effectively. In the next session, some powerful insights were shared by Alpana ma'am on enhancing literacy outcomes in Indian children and the intervention approaches that truly work. She began with the reality that we often ignore. Parents are usually the first to sense that something is wrong, but many stay in denial. That delay hurts a child. She explained that effective literacy intervention in Indian children rests on five core areas. Firstly, physical development. Secondly, emotional development. Third is basic literacy skills. Fourth is language acquisition. And fifth is numerical skills. She explored each area in depth, far more than I can cover in the short video. But the message was clear. Literacy is not just reading and writing, it is built on an entire foundation of skills. Under literacy skills, she emphasized attention, concentration, perception, memory, listening skills, and inner language. Under language acquisition, she also discussed reading and spelling in detail. One point she stressed is hard, and frankly it's true, is that many speech therapists hesitate to collaborate because they fear losing clients. That mindset harms the child. There is no absolutely no downside to referring a case when required. This work demands a team approach. Real literacy improvement happens only when parents, special educators, psychologists, medical practitioners, and all relevant therapists work in alignment and not in silos. Her message was simple. Literacy intervention must be comprehensive, collaborative, and centered around the child and not the ego of the professionals involved. The final presentation of the entire workshop was honestly one of the strongest sessions of the day. The topic was how to integrate auditory processing skills into language and literacy intervention program, and it was presented in a very systematic and structured way. We had three expert presenters, and each of them focused on different age group 1 to 3 years, 3 to 6 years, and 6 to 10 years. And what was interesting is that each speaker discussed practical strategy based approaches for improving auditory processing within therapy or classroom setting. One example that stood out was about improving speech in noise listening skills. They shared a simple but powerful activity called Whisper Challenge. The idea is to play continuous background noise at a moderate level, stand close to child, and give short and simple tasks. For example, touch your nose. What is 2 plus 2? Tell me two animals. This helps train child ability to pick up speech in noisy environments, something that many children struggle with in real life situations, especially in school. Another strategy discussed was improving dichotic listening using competing commands. In this activity, child wears headphones and hears different instructions in each ear at the same time. For example, in the right ear, touch your shoulder. In the left ear, stand up. The child has to perform both tasks simultaneously, which strengthens their ability to process two streams of auditory information at once. They also talked about environmental and compensatory adjustments, which we often overlook, but they can make a huge difference. Some key points included improving the listening environment, using preferential setting, having the speaker use a slightly slower speaking rate, pairing verbal information with visual cues or reinforcements, reducing cognitive load by breaking complex instructions into simpler and manageable pieces. These strategies are simple but highly effective, and each presenter gave many practical examples. But of course, it's impossible to cover them all here.